colleagues, this is Dr. Jean, and I'm so excited to share with you some of the new technology on how you can provide option to your patient for oral health care. And I'm so honored that we have two special guests right now. Of course, we'll introduce first the pretty young lady here who will sometimes translate to us. You know, if Kevin would like to speak in Korean. Yes.
Okay.
Yes. Hangul. Yes. Hangul. Yes. So anyway, this is Serena. Please
Hi.
say hi to our doctors everywhere, not only in the Philippines, but some of the registered dentists in other countries, especially in Southeast Asia.
Oh,
Yes.
wow. Okay.
And of course, we would like to introduce a very special guy who I've been friends with for a very long time. And he is none other than Mr. Kevin Lee. Hello, Kevin.
Hello. Hello, everybody. 안녕하세요.
안녕하세요. Yes. You know, colleagues, we're right now very happy because we're visiting Seoul, and Kevin here is so nice and generous that we get to see his new office that is really very beautiful. And if you ever visit Seoul, please do stop by in their office because they have the entire one of the part of their big floor.
Yes.
And you can see the different models of what we're gonna discuss right now. So a lot of dentists are quite concerned on certain parts about water floss. So one is that let's discuss first the benefits of the water floss if they introduce it to their patients. So what are the benefits that they can advise the patient that they will get from water floss if they buy it?
Okay. Dentists, you may know about the oral irrigator, that how much important that. We recommend manual toothbrush, but that is not enough. So
Okay.
dentist, you are rich man, right? So we are human being. Everybody same. The gum line and then subgingival line is everybody same. There are 2 or 3 millimeter is some pocket there, so a lot of foods in there. So manual toothbrush cannot reach the deep inside. So so we developed the oral irrigator. So oral irrigator can clean the teeth and gum perfect. So we developed that.
Okay. So, Kevin, what you're trying to say is that they can advise their patient to use. So the proper word is not water floss, but oral irrigator.
Yeah, oral
Yeah.
irrigator.
So
yeah.
so that's the proper term.
Yeah, more
for-
correct word. oral
Correct
irrigator,
word, yes, for professionals. So of
Yes,
course,
yes.
we need to look professional to our patient. So the right word is oral irrigator.
Yes.
Yes, and as you said, do they still, like if the patient will ask them, do I still need to use the manual floss, or they can just from toothbrush, they can go directly to an oral irrigator like an aquapic? What is the ideal way of, for them to advise their patient?
Okay. Especially you are dental professional, you do implant and then orthodontic patient and then periodental treatment. So especially after implant treatment, there's some pocket inside between implant fixture and then gum. And then, that part is very hard to clean, and then there's some pocket inside beside the implant fixture. So if a patient they clean carelessly around the fixture, after a few years later, they found some peri-implantitis. So that is very headache to dentists, also patient. So dentists they know well about that. So dentists recommend strongly to use aquapic oral irrigator in Korea, also other country dentists.
Okay, so for implant patient, do they already advise? Can they already advise oral irrigator or
Yes.
aquapic?
Yes.
Once they put the post.
Yeah. Good
Or
job.
do they need to wait until, the second component is attached?
Yeah.
It doesn't matter.
Doesn't matter. Yeah.
So as long as they started doing the implant, the patient can already use the oral irrigator to make. Does it make the healing of the gums faster?
Yeah, of course, yes.
Ah.
Because what we patient can adjust the water power after treatment and the implant, and they can reduce the power first step, and then after done that, they increase the power medium and high, and then 1 year later they can, if they use the highest power, it's more good for the gum health, because the pulse can make the blood circulation, improving the blood circulation, so
Okay.
more stronger than before.
Ah.
So dentists recommend the oral irrigator after the implant treatment. Yes.
Interesting. Okay, so we will stop for a while, and you will see Serena here do the demonstration of how an oral irrigator works. Right? He's just gonna use a corn as a model, and you will see how fast like Aquapic can clean the food debris in a matter of 30 seconds only, right?
Right.
So please watch it, and you can see the benefit of what Kevin is talking about.
Do. So in Korea, there is a lot of food that include this kind of red pepper sauce, right? In kimchi or bulgogi, there's a lot of
Bulgogi.
food. Yeah, bulgogi. So there are a lot of food that includes this. So this one is actually representing the teeth with the red pepper sauce. And let's say we brush it with a toothbrush, and it's going to do remove some parts, but not everything.
Oh, not everything. So I can
Yeah.
see there's still a lot of debris right there. So the reddish color is there. Wow.
Right.
So even
See?
if you brush it,
Yeah, even after brushing, it's still remaining.
dahil pong natitira mga pop-up.
So we're going to test the Aquapic how well it removes it. So it's going to do within 30 seconds. So I will time it.
Oh, so you have a timer right here.
Yeah. Let's start.
Okay. Oh wow.
Yeah, it's removing it.
So it really cleans it like that.
Yes.
That easy, eh?
Mm-hmm.
Wow.
See, it's all clean now, right?
That's all water and pressure. So
Yeah,
can
so-
I see it close up?
Yeah. See?
Oh, no more.
No more. No more red
So how
pepper
fast
sauce.
was that? Like less than 30 seconds actually.
See, it
Yeah.
cleans pretty well in a very fast speed.
Okay.
So this
wow.
is how effective Aquapic is.
Yeah.
Yes.
So once again, this is Serena and this is Jericho showing you how Aquapic is very effective in trying to remove debris from your teeth
Right.
using a water floss.
잘했냐고요?
Thank you.
Thank you.
See you, Moms and
Bye.
Pops. Bye.
Okay, so now you got to see how fast it is. Just in 30 seconds, you can actually remove most of the debris on the teeth, right? So, Kevin, besides implant, you've also mentioned those who are wearing braces, right? So, how good is an oral irrigator when the patient is wearing braces?
Yeah. Most of orthodontists, they may know well about the orthodontic patient. They have a lot of the caries and then some gum disease after 2 or 3 years later. After getting rid of the bracket, they can see a lot of caries and gum disease. Then that why many caries after done that. There are between braces and then teeth and then the wire. They're very complicated, small part there. So after brushing, if they patient use Aquapic or irrigator, they can see a lot of small food debris on the base.
Yeah.
So that meaning is that the manual toothbrush is very hard to reach the deep inside part. So very hard to clean that. So the orthodontist they recommend aquapic or irrigator strongly to their patient.
Okay.
Yeah, don't need to say a lot of words because after using that, patients they know after 20 seconds they know well about the
Yeah.
result.
Yeah, because as you can see, Kevin, I'm not an orthodontist either, but basically most of the people who wear braces, there's a lot of components that are placed on the tooth surface. So
Yes.
the problem is, especially if you're trying to straighten the teeth, so of course you have the brackets, the wire, the rubbers, and all of these things. And sometimes one of the complaints of a lot of patients is that it's very hard to brush their teeth.
Yes.
So with the help of Aquapic, you can actually remove the debris without any difficulty because it uses the water pressure,
Yes,
right?
yes.
So now, of course, when they're patient, because I will show you some of the models that you have, right? So that you can, the dentist can actually make their patient choose which one is their preference, and I think this is for those who travel a lot. Or are you planning to have a smaller version, like you can place in like if in your a restaurant, you can actually bring it along? Maybe that's a good idea, Kevin. A smaller pocket. But this one is cordless, right?
Yeah.
And you only have to charge it overnight, and then the charge can last until 2 to 3 weeks.
Yes,
right?
yes, yeah.
And then as you can see on the demo of Serena, right? Only 30 seconds, so it doesn't use a lot of power. Yes, and so basically this one has 3 kinds of setting. There's the clear,
Sure,
so
clean.
clean. Okay, the clean
Clean.
one. Sorry, the clean one.
Power.
Yeah, the
And
clean
soft
one.
power.
Yes.
And massage power.
So what is the difference between the clean, the
Okay.
the soft, and the massage?
Normal people, we recommend the strong power clean.
The clean one.
And children and dental patients, they recommend soft one.
Okay.
And massage function is good for the blood circulation. So if someone wanted to do the massage, they can set in the mode massage function.
But the massage is even softer than the soft, right? What is the pressure?
High and a little medium pulse, and then massage function here. First is massage function here.
Okay, so
Medium to high.
medium to high
Yes,
force.
yes.
So the highest force is the clean.
Clean.
And then
Soft,
the massage.
low power.
Yes,
Massage
is the medium high.
Yes.
Okay, so there is a question on some of the dentists in terms of surgery.
Okay.
Like, of course, there's like, for example, if they have impaction, can you actually use this to irrigate?
Yes.
To clean the
Sure.
cavity, and
Sure.
then place us. Can you place other solution besides water?
If a dentist recommends some special solution,
Yes.
as you recommend to use that by dentist recommendation need that.
Yeah, let's just say I'm a dentist,
Yeah.
and I want to use it on my patient because I'm doing surgery.
Yes.
So I can place other solution inside, right? It will not affect the.
Not affected, no
Okay.
problem.
Is there a certain consistency?
No problem, yes.
So let's just say for chlorhexidine.
Yeah, crushing, no problem.
Okay, so you can actually like use it to clean the pocket.
Yeah.
Once you do the extraction, because sometimes you have a root pocket, so you are sure that it is clean before you do the stitch, right? So you can use this.
Yes.
And what is the setting that you recommend? Is the massage?
Or
the
dental patient, they recommend the soft button
Soft.
first.
Yeah,
Yes.
okay.
And then they recover at a few months or 1 year later. We recommend the strong power clean button.
Okay. So you see, because Serena, Kevin, most of the dentists, what they are concerned about is that if there is already surgery, and of course, if you do surgery, there's already trauma. They are worried that the pressure of oral irrigators in general might affect the healing of the gums. So they can actually adjust it first to the massage, right? Or to the soft first.
Yeah.
Okay, and then they can increase the power as the gums heals.
Yeah.
Ah.
Patient, they may know after a few months later,
Yeah.
I can increase the power. They know. Well,
Okay. And does oral irrigator actually lessen the production of tartar? Like the calcular deposit? If you use this often, does it lessen the production of the, you know, the
Yeah.
hard,
Yeah.
the hard calcular deposit
Mhm,
that
definitely.
it lessens the
Yeah.
the formation of that? Because
Right.
Kevin, there's some patient like they just had a cleaning, a prophylaxis now, and then after a few weeks, there's another formation of tartar or calcular deposit, as if they had not done any
'cause
oral
it
prophylaxis.
builds
So
up
does
again.
this one help to lessen the production of this?
Definitely.
How about nicotine stains? Because
Nicotine stain.
yes, it doesn't remove.
It's for the whitening.
Yeah, so but does it helps also for some? Oh no.
Oral irrigator purpose is to clean the between teeth and gum lines, food debris. First
Okay,
purpose.
so,
Yes. This is
okay.
not whitening product.
Products.
Yes,
Okay.
yes.
So so basically, they also have another thing. What are the consumables of the patient? If the dentist will you sell this to the dentist between how much?
We retail price is $120 to $150.
Okay.
Retail.
What is that the price of the patient already, or the price of the dentist?
Retail end user's price is $120 to $140-$150.
So they can sell it for 120 to 150 to their patient.
Yes, yes.
Okay, and then depending on their distributor,
Yes.
that's how much they're gonna buy this one. So actually, colleagues, you can actually sell this in your clinic as a part of maintenance when they have a treatment, right? So so then they can sell it for 120 to 150.
Yes.
Yeah.
Depend on the market and the countries. Yes.
Okay, so it's really what are the consumable parts? The tip.
We are not recommend to replace this part strongly because
Yeah.
this you can use rewash.
Rewash, okay.
Of course, the customer, if they buy tips every month,
Yeah,
we
yeah.
can be rich, right?
Yeah,
We get a lot
yeah.
of profit, but
Yeah.
frankly speaking, if they use reuse after washing, that they can use reuse. Also, if they use some sterilized solution, you can kill the bacteria. So you can patient can use it many months and many years.
Yes, and this is what Kevin is talking about. This is a tablet that you can actually clean the machine. And we will show you a clip wherein Serena, again, our pretty model, showing you how you will clean this using their tablet, right? So this one doesn't only clean, but actually also remove the bacteria. That's the biofilm that is formed on some of the parts. Of course, after a while, any equipment or material, it gets dirty, right? So you need to clean it. And you said cleaning it at least once a month, correct? Or
once a
every
month,
6 months?
or someone wanted to use the 6 months, but depend on their patient, customers, their mind. But this is water machine, right?
Yes.
So a lot of biofilm inside.
Yes,
so
yes.
If they use this tablet every month or every 2 months,
Yes.
it's very recommended. But only the 6 months one time.
Yes,
Yeah.
I think, colleagues, I think for me, if you bought this for your clinic and you use it to different patient, I think you need to use this at least once a month.
Yeah.
Because you're treating different patient and
Yeah.
you're using the same machine.
Yeah.
And then you really have to replace the tip, so for infection control. But if it is for personal use and your patient is buying it for themselves, then I think 3-6 months is already okay, because you're using it for yourself.
Yeah.
I mean, no other people is using it, and they also have a model here like this one that actually for the family, right?
Yeah, families.
Yes, and you can actually there are some models that like this one, you have another model that use the same tip, right? But the individual has a different tip than the one that, what is the model of this oral? This is AQ300. Yes, okay. So AQ300 is being sold at around 5,950 pesos. And then for the cordless, it costs in the Philippines 4,450 pesos. So it's even less than $100. And then they also offer, this is something new, which is this is the wow, okay. It's an electronic toothbrush, and this also has 3 settings. Okay. What is that?
Also same, the same.
Yes,
Clean, soft, massage function.
Yeah.
Same. Most of the adults we recommend uses the clean.
The clean, and for
children
the children,
or
soft.
some patients we recommend the soft one.
Yes,
first.
yes.
And then they can move massage function.
Okay. And is that the normal sound? Okay.
But if you
And
put
how
the-
when you put the okay, so
No
it
sound.
decline. Yes.
Yeah,
Because the vibration, there's nothing that's stopping it. But what is the movement of the brush? Is it like this,
Yeah,
or
yeah.
it's circular?
Like this.
It's like swaying
Yes,
side to
yes.
side.
Yeah.
Okay, and then
Because
is it this?
that is important. Because we recommend to brushing the ways like
Yes,
this.
yes.
Not just like this.
Yeah. So 45 angle. Yeah.
This hair moving
Yeah,
like this.
yeah.
Okay.
Okay, and this one, the only do they? How long does the shelf life of the battery?
The battery is 5 years warranty.
5 years,
Yes,
and
yes.
then they can actually buy it or a replacement, or
replace
they.
or a new one.
A new one, yes.
After using 5 years, at 15 to
Yeah, I
20%
think-
lower.
How much is the? How much
Around
is the?
$100.
Okay, so it's almost similar. Yeah. So, and do you have other colors, or is just white?
Of course, we are developing other new color, but currently is white color is best seller. We're gonna launch
Okay.
new another color soon.
Yeah, for some reason, all medical devices is color white because it
Yeah.
looks very clean.
Clean.
But for me, I don't like white because once it stains, you can see it. So I prefer either dark gray or black. So anyway, they also have a very special, which I really like, and this is it has a UV light, right?
Yeah.
And then you can actually place your toothbrush. They can use whatever toothbrush, right? But they also sell a special toothbrush, and then they can just, place it and then close it. And then automatically you can see there's like a blue light.
I show you.
Yeah.
That's if you open the cover.
Yeah.
Is it stop the light?
The light,
If
yes,
you-
and
if
close.
You, close.
Yes.
Turn on the light.
Yes.
UV light.
Yes.
It can kill the bacteria.
Yes. And for the plastic, this one, how do you clean this if this one becomes dirty?
Just the wet towel is enough.
Wet towel.
Yeah.
Can you use a disinfectant? Because there are wipes that are medical graded, non-alcohol, that can clean. Can you do
Yeah,
that?
no
It
problems.
doesn't
No
affect the
problem.
plastic.
Yeah, no problem. This is very durable plastic, and then do not change it, not changing the color, and then not scratchable.
Okay. And then the battery is AA, right?
Yeah, you can put a double A,
Yeah.
2 pieces here, one
Yeah.
and
And two.
2.
Okay.
You can use this battery. 2 batteries can use at 8 or 10 months.
Wow.
Yeah, if you just 1 or 2 times using, and if you use every 3 times, it take 6 to 7 months.
Okay. So for this one, you just like store the toothbrush, and then how long does the UV light like
10
turns
minutes.
on? 10 minutes.
Yeah.
Okay.
Automatically turn off.
Okay. So so this is really a very cool way also selling in your clinic. And this is $100 they pay, they charge their patient, right?
But this is very cheap one.
Yeah,
for you.
yeah.
Just
Yeah, because I travel a lot, and I like, because I teach infection control, and the problem is, look at this, it's very hard to clean. So it sometimes, you're trying to clean something, but you're cleaning it with the dirty thing, so it doesn't work. So I think this is a very good idea, Kevin. I mean, this is really nice to promote to patients, especially those who are like me, is very OCD. And then we would also like to show something that is different that we will show you in a while through the microscope. And this is very unique. This is a mouthwash that you spray, and then it turns into a foam, right? And then you just gargle it for how long do you need to put it in your mouth before it becomes totally effective?
30 seconds is enough.
Yeah, see, they're all quick. Because normally on all mouthwash, they ask you like a minute, or even some 5 minutes or 2 minutes, and sometimes you just want to spit it already. And then I actually tasted it, and it's not bad. It's kind of minty.
Yeah.
Yeah, and so unlike the other mouthwash that you cannot sometimes swallow, and then you're already tired holding it in your mouth. So this is it the same as the other mouthwash or toothpaste that they claim that when you wake up in the morning you don't have morning breath?
Yeah.
Does it help?
Totally. After using one time, you can get the feeling. It's so fresh.
Yeah.
And then I recommend at least 1 or 2 times per day.
Yeah.
It's very fresh, and then feel is very good.
But I mean, the morning breath is when you wake up in the morning. Does it, like, if you use
you
it
can feel
in the
that
evening?
no smell.
No
the
smell?
Morning,
Yeah.
yes.
And for I'd like to try it, because as a smoker sometimes it's good if you have something to remove the smell of the cigarettes.
Yeah.
And you just don't have you can also not rinse it, right? I mean, if you spray it and then you spit it, you don't need to rinse it with water, right?
Yes. Most of the manufacturer, they recommend not rinse again.
Yes.
But patient can decide after the mouthwash goggle, rinse or not. The patient can decide.
It doesn't matter,
because the mouthwash goggle is a very safety material.
Yeah.
So even
so they can
eat a little,
actually
it's
swallow
no
it.
problems, yes.
So for children, it's not also a problem.
Yeah, we are receiving the FDA certificate. It's
For children.
very safety.
Okay. Because sometimes there's a big issue about fluoride.
Yeah.
Like for children, they get to swallow it.
Yeah. This one is the non-alcohol, and
Okay.
no CMIT and MIT.
What are those things, so that they can
explain
understand?
about that?
Yes. Please tell our doctors.
Okay.
What is the advantage of this one,
Okay.
not having
I need your
all
help.
these components?
This is the main ingredient, is the natural ingredient.
Okay.
So do not need put the 방제가 썩지 않게 그만.
The material that prevents from rotting.
So the shelf life.
Yeah.
So some of the manufacturers add those ingredients to increase the shelf life of the product.
Right.
Yeah.
That's correct.
So, and then the problem is that it becomes dangerous to the patient.
Right.
Yes.
Okay.
Even this is a natural ingredient, but the shelf life is 3 years.
Wow.
So that is our technology, and then people like this one.
And how much is the retail price?
Retail price around $30, $30.
Okay.
And then you can use 5 to 6 months, one bottle. If you use it as the one-time pumping,
Yeah.
I'll show you pumping. This is one-time pumping.
Yeah.
Okay. Can you smell it?
Yeah, it's as I've said, it smells really good. It's not like a medicine. I actually like it. We will show later the effectivity of this. Okay, and then anyway, I have forgot one question, last question before we proceed on how effective the mouthwash is. How many times do they need to use
Per day?
the oral irrigator? Yes.
Yeah, we recommend 1 or 2 times per day.
So doesn't have to be 3 times a day.
But people like it to use every 3 times. But it's okay. But at least 1 or 2 times people sleeping.
Ah, yes, yes.
Yeah, yeah.
So in the morning or in the evening, right?
Yeah, before the sleeping is most important.
Yes, yes.
Yeah.
So basically, these are the products, doctors, that are currently available in the Philippines, and we will pause for a while because we are going to test this very. I think I will like this. This one. I hope it will be available in the Philippines, but. It's already available. Is it available outside Korea
Yeah,
already?
we export it globally now.
Okay.
Because we received the FDA certificate and then Korea KFDA certificate. We got it, so this is very safety item. We
Okay.
export it globally now.
Okay, and also doctors, I will place the contact number of the distributor in the Philippines, and also I will ask them some of their distributors in Southeast Asia or even in the United States. Do you have already a distributor in the US?
Yeah, just starting.
Yes,
Now, yes.
yeah, okay. So anyway, I will place also their contact number or their email address so that these are all can be repaired, right?
Yeah.
They offer service also. And the warranty is how long?
Most basically it's 1 year warranty.
1 year, okay. And then for the parts, they're also available, right? Because
Yeah.
it takes a while before they need to replace it.
Yeah.
Okay, so again, we will proceed now to test the foam.
Yeah.
Okay.
You will surprise that.
Yeah, try. Don't do too much.
너무 많이 봐. It's gonna be a horror film.
One is very strong,
Yeah.
but after done that, it's look. James, let me see that. Have a seat. Have a seat.
Yeah, yeah,
Look
yeah.
at this movie.
Let's watch
see the
the
movie.
Yeah.
Let's watch the movie. Need to take a photo. Check out.
Yeah.
Movie.
Yeah.
I'll explain. Look. Look at that. That is movie. Remember that there are a lot of okay. So it's
It's very interesting.
yeah.
What does it mean?
Many position.
Ah, okay.
Scientists.
Yeah.
You can find some bacteria, but not
Yeah.
moving fast.
Fast, yeah.
Very low.
So they're dying. Yeah.
They're dead already. No more zombies inside your mouth.
They hit their head, so they are looks like a zombie. They are stopping, not moving.
Yeah.
There's nothing to moving on. Not 100%,
That
but
one is
99.9%
trying to
not moving, nothing.
breathe.
Some parts
Ah,
disappear, all bacteria,
Wow.
disappear. I'll show you the camera.
There's aliens in there.
How many bacteria? This one.
Oh my god.
Wow.
Is that an alien in there?
Wow. Wow. Lot of alien. Need to show the nose. Say ow. I never cast it like that. You know, this first case.
Yes.
I never tried that. Wow. Wow. It survived. They're moving.
Yeah.
Wow.
They're alive. Holy
You know.
shit.
You know, that is the biofilm.
Yeah, the
Look, it's
biofilm.
moving.
Oh my god. Holy shit.
Jeans toothbrush case. Okay?
Yes.
So type of jeans toothbrush.
Holy
Look at that.
cow.
Jeans.
Yes.
There
I
are-
know.
There are a lot of different
I
bacteria.
know. Oh, yeah.
Oh my god.
Oh gosh. gosh, I
Look at
didn't
that.
put it in my mouth.
Very delicious
Oh,
bacteria.
yeah, I know. Wow.
You're not gonna use that again, are you?
Yeah.
And-
That have to work. This one I have to throw. It is not cheap, actually. And then I cannot even clean it properly.
You know, your teeth is more clean than one.
Yeah, I know. Okay. So, colleagues, you seen the how dirty how dirty my toothcase is. And then also we tested Jericho and one of the employees of Aquapeak. They already have brushed their teeth, and yet there's a lot of bacteria, right?
Mhm.
And Kevin, this is really an amazing product, and this is called the Aquapeak cleaning foam, and you only have to use it once, right?
At least one times per
Yes,
day.
and he has a tip to combine two of the things to make it even effective, right? So one is you spray it, and then you can use the toothbrush and the toothpaste and then brush it, right? And then the other one is using the oral irrigator of Aquapeak. You put this on the water
Mhm.
and then you clean it.
Yeah. How to
Wow.
put that?
Yeah,
Yeah.
just
Yeah. Like this.
wow. So as you can see, it becomes there's a little bit of foam. So it's now you're not only cleaning it, but you can actually kill the bacteria.
Yeah.
Yeah, and this is really exciting for maintenance, oral maintenance,
Yeah.
and you said children 4 years and above can already use it, and it's safe, and sometimes you don't need to rinse it, right?
Yeah.
So anyway, I hope as dentists, you will try to consider some of these things to help your patient prevent caries, prevent a lot of oral diseases, because it is helping the oral environment to be free of bacteria and to be really clean.
Yeah.
Yeah, and then I think this is also, a lot of these things is very effective after treatment. Like for example, for oral prophylaxis or surgery, it will really help the gingiva to be healthy.
Yeah.
Because sometimes, as you know, that a lot of patients think that they just have to take care of the teeth. But actually, they really need to take care of their gingiva and the bone, because these are structures that holds and support our teeth. And it's very difficult to train.
Yeah.
To treat it once there's already a problem, right? So anyway, dear colleagues, thank you for staying the entire video and seeing all the exciting products for oral hygiene. And again, kamsahamnida.
Kamsahamnida.
Yes, thank you so much, Serena. And thank you so much, Kevin, because he's really a generous guy. So thank you so much. And I will indicate below all the information where you can buy the products. If you have any inquiries, you can also send me a private message in our page at Facial Value, or even send an email in my contact page at dmd.center. Thank you so much, and I hope you have learned so much in the entire video on how you can advise your patient to have a better oral hygiene. Thank you,
Thank you.
Yes,
Thank you.
thank you.
Thank you, Sarah.
Thank you.
Thank you.
Thank you for
Bye-bye.
watching.
Bye.